we are now back on the subject of COVID-19. Why? Well, since things have started to reopen, a lot of politicians and media outlets have reported that the cases of COVID-19 are now increasing now that people are out and about and doing things. And that's what you would expect from a contagious, disease, that it increases if people start getting near each other and whatnot. But they don't have a whole lot to say other than that. They just say that the cases are increasing and we should look to put in more restrictions and shut down places again. Well, hold on a second before we do that, because you're leaving out a lot of information there, right? You would want to know the full story of what's going on and maybe all the details before you close entire economies back down again. That didn't work so well this last time, and you really, really, really want to be sure if doing that is the right thing before you just jump on and do that. But before we get to why all those things that they're posting may only show part of the story, I want to read you a specific example. Now, I have a tweet here from Alex Berenson, who was in contact with this Neiman guy who, is associated with 13 emergency clinics in Texas. And I want to read to you an email that the guy associated with the clinics sent him on his experience with their emergency clinics and the COVID patients and the testing and everything coming in, all the information on that based on that story. So, he emails him. I am the managing partner and general counsel of a Texas-based company that owns and operates 13 freestanding emergency clinics in the state of Texas. I follow your reporting and wanted to share with you some information on Texas. I want people to hear this story as opposed to the mainstream reporting. However, I'm sensitive about putting a target on myself or company for conveying this information. I'm not sure how you've handled this type of situation, but I suspect you've had other people send you information who are concerned about coming a target. In June, we tested over 2,231 patients. This was data through last Thursday. The positive rate is now close to 20%. So 20% about are testing positive for COVID-19. Vast majority of the cases, and it says that it was 46 in May. Vast majority of the cases are mild to very mild symptoms. The average age of people getting tested is mid-30s. Very different patient in terms of age than we've seen before June. Most of these patients would not have met the strict criteria that we previously had, and all health facilities had, for COVID testing. Now, with more testing kits, we are able to test a broader group of patients. Okay, so again, one reason that testing might be up, or that cases of COVID might be up, is because an increase in testing. He just said more testing kits, they're testing a broader group of patients. So if you weren't testing those people before, and you are testing them now, if more people had it than you thought, it would make sense that the number of cases is going up because you're finding out that more people actually had it to begin with. It doesn't mean that cases going up, it doesn't mean that more people have it now than did in the past. It just means that you now know more people had it than had in the past. Clinically, we've had very few hospitals transfers because of COVID. Vast majority of the patients are better within 2 to 3 days of the visit, and most would be described as having a cold, and a mild one at that, or the symptoms related to allergies. We've often provided a steroid shot and some antibiotics. By the time we have a follow-up call with most of the patients, they are no longer experiencing any symptoms. They often say that the shot made a difference. Okay, so a large percentage of these people that test positive for COVID are simply treated as if they had a cold or allergies and given, let's say, a shot or some antibiotics, and they say that it made a difference and they feel better in 2 to 3 days. So again, that doesn't portray, that really puts into perspective the severity, at least on a majority of the people that come in, the severity of the virus and what it can do. So it's not necessarily as deadly as it's being portrayed. In terms of what is driving them to the ER, roughly half have been told by their employers to get a test. They have a sneeze or cough and their employer tells them to go home and get tested. The other half just want to know. They have mild symptoms, and some don't have any symptoms, but game the system and check a box that they have a symptom so they can get a test. They cannot get a test unless they present with symptoms. They have no symptoms, we send them away, which does happen. So again, more things contributing to why we see a rise in cases. Again, I said more people are being tested, but why? Well, the economy is reopening. A lot of bosses at these companies, if someone looks like they have symptoms, the boss is like, well, I don't want to get in trouble. I want to be safe. I want to make sure no one gets this because apparently it's really bad. So the boss then says, hey, I need my employees to go get this test. So people who might not have gone into the test because they just thought they had a cold or mild symptoms as these other people had are now going in to get the test. Additionally, you have a bunch of people who now just want to know and are even faking symptoms and saying they have symptoms just to see if they have it or not. So you're having people tested in a more broad range because there's more tests available. People are going in, they're being told to go in. Let's continue. The average length of a stay of a COVID patient is 3 to 5 days, much lower than patients being seen in April and May. Their symptoms are also milder. Most of these patients are not ending up in the ICU. The hospital ICUs are filled with really sick people with non-COVID issues. They didn't come in earlier because they were scared, and now they are super sick. From multiple sources at different hospitals, they have plenty of capacity and no shortage of acute care beds. No real data on breakdown of patients who have COVID but are not in the hospital because of COVID. Recognition that because all patients are tested for COVID, you have some percentage of patients listed as COVID patients who are non-COVID symptomatic, and the hospitalization rate is somewhat driven by hospitals taking in their normal patients with other medical issues. So again, this whole idea of hospitals being overrun, while it may happen in some places, it's not happening in necessarily a majority. And then the ones it is happening in, you can look into additional stuff on this. A lot of times, these hospitals that say they're looking like they're going to max out capacity and going to be overrun, their numbers actually aren't that different than maybe a year ago or their normal ICU rate of how much is filled up. And it's really not that different, but they're saying they're getting overrun and it's due to COVID. But that's not necessarily true because if you're testing everyone that comes in for any problem that has COVID, as you'll see here, the hospitals have incentive to list it as COVID. So finally, heard several stories of how discharge planners are being pressured to put COVID as the primary diagnosis, as that pays significantly better. Hospitals want to avoid the discussion, but if they don't, they risk another shutdown. This may be an explanation of why there's a gap in hospital executives saying they have plenty of capacity and the increasing number of COVID hospitalizations. You open up your hospitals for normal medical care and you test every one of those patients. The result is a higher percentage of patients who have COVID. That makes complete sense. And it goes on with one last post here. Something else to pass on. Since COVID hit, our ER volume has decreased 50% in the month of April. However, our percentage of level 5 ER claims, the highest level in very high acuity patients, doubled. The patients that did come in often waited much longer than they should have and normally would have. People were just so scared. Overall, based upon what we are seeing in our facilities, the above information is really more of a positive story. You have more people who are testing positive with minimal symptoms. This means that the fatality rate is less than commonly reported. Okay, so this is just one example of a story. And you can see at the beginning, it talks about he's afraid to come out and say it because of what that can mean for him and his company. And I think you probably have that a lot out there. People are afraid to come out and say things because if you don't agree with whatever's mainstream and being said on the mainstream news or by politicians or on Twitter, if it's not the correct thing in the other group's eyes, then you are attacked. And, this guy wants to get honest information out there about what's going on, but also doesn't want to be attacked. So I'm guessing that this isn't the only case of this, but as you can see overall, the idea of COVID being super, super deadly and widespread, and then we need to shut down because of it, doesn't really make sense because of everything he laid out here. I want to show you a couple graphs here. So if you look at this graph here, I saw both Hillary Clinton, Joe Biden, post this on their things, and it's just this. They post, oh, look, new confirmed cases per million residents in the previous 7 days of coronavirus, COVID-19. And it shows United States. It goes up, goes down, and then shoots back up. All these countries go down, go down, go down. Well, first off, let's clarify. what did we just read, about this guy and all the emergency clinics he deals with, why testing would, why cases will go up? Well, we just saw that with evidence of how many people they're testing and all these people coming in for tests and testing being more widespread and easy access and more people coming into the hospitals and everyone in the hospital being tested for COVID no matter what they're in for. So you have a variety of reasons why you would find more cases if more testing is being done. It's so simple. It's a simple concept. It doesn't mean, this graph right here doesn't mean anyone's doing a good job or a bad job. It just means that there are more confirmed cases. But when these politicians tweet this graph, what they imply with their text that comes after or before is that the United States is doing a terrible job, this administration is doing a terrible job, we need to shut everything back down. You know the lines. What they don't post is this graph. This graph shows the same thing with the blue line, the number of confirmed cases, captured cases. It goes up, goes down, and then shoots right back up, just like you saw in the other one. What does the other graph not include? Oh, that's right, the deaths. What's going on with the deaths? And this is from March 1st to June 28th. The deaths go up with the cases, but drop off and continue to drop off over time as the cases are now increasing. So why don't they include that? Why do they not feel the need to mention that? I would think that's important. That's a very large chunk of why we would talk about the virus, is that people die from it, right? I mean, that's a big aspect of it. So wouldn't you want to know how infectious it is, how many people have it versus how many people die from it, so you can know how to respond to it? Well, a normal person, yes. Someone who's trying to push an agenda for something, no, they don't really care. They find the part that fits what they want and move on. So we see a lot of this, they're saying, oh, the cases are spiking, it's so deadly. Well, as human beings, we take numerous risks every day, right? And what you have to do is you have to weigh whether what you're trying to do with living your life is worth taking whatever the risk may be. A lot of people die in car accidents, and it's not always your own fault in the car. It could be someone else's fault in the car, but you're taking that risk to get on the road, and you're going to assume that you're going to be okay, and it's worth taking the risk to get to where you want to go and drive your car. And, maybe there's some food you like or something, and there's a potential that it could hurt you eating a lot of this down the road, but it really tastes good, and you want to do it anyway, and that's how you want to look, whatever. People are going to look at this and decide how they want to live their life, right? If you are truly scared of this coronavirus, granted, you get honest information on the death rates. Let's say you had all the information. If you are still truly scared of it and really afraid of getting it and don't want to die, you need to adjust your life accordingly, right? If you really think it's that big of a concern, stay inside. Have things brought to you, sanitized, and do your best to stay at home. Adjust your life for that. But if you want to remain open and do things and be around other people and accept that, hey, other people might have it and be around me, granted, if someone gets all up in your space, that's violating you, that's one thing. But being out around people, you're taking a risk. But is that risk worth it? And as we look, we see that it really isn't as deadly as it was made out to be. And even now, you have articles coming out saying that, yeah, actually, it's not. So let's look at this one here. So this article asks the question, how deadly is the coronavirus? Scientists are close to an answer. So we've been getting some data in, and they're still trying to figure out how deadly this thing is exactly, but they have estimates. So one of the most crucial questions about an emerging infectious disease such as the new coronavirus is how deadly it is. Very important part. After months of collecting data, scientists are getting closer to an answer. Researchers use a metric called infection fatality rate, or IFR, to calculate how deadly a new disease is. It is the proportion of infected people who will die as a result, including those who don't get tested or show symptoms. The IFR is one of the most important numbers alongside the herd immunity threshold, and has implications for the scale of an epidemic and how seriously we should take a new disease. Calculating An accurate IFR is challenging in the midst of any outbreak because it relies on knowing the total number of people infected, not just those that are confirmed through testing. But the fatality rate is especially difficult to pin down for COVID-19, the disease caused by SARS-CoV-2 virus. Says Timothy Russell. Okay, that's partly because there are many people with mild or no symptoms whose infection has gone undetected, and also because the time between infection and death can be as long as 2 months. Many countries are also struggling to count all the virus-related deaths, he says. We'll stop here for a second. That tracks with what we're seeing with the amount of cases increasing. We see that testing is now increasing. More people are being tested. More people are coming in for tests. Employers sending in people who are going to hospital for other things now that aren't afraid and not staying home. They're being tested when they get to the hospital. It's being revealed they have COVID. People coming in with mild cold symptoms being revealed they have COVID. More and more people are being found out that they have COVID. So that would make sense that the numbers before were off if we didn't realize it was infectious as it was. We'll continue. Data from early in the pandemic overestimated how deadly the virus was, and then later analysis underestimated its lethality. Now, numerous studies using a range of methods estimate that in many countries, some 5 to 10 people will die for every 1,000 with COVID. The studies I have faith in are tending to converge around 0.5 to 1%. Now, that's the numbers they're starting to zero in on, is somewhere in that range, which is pretty low. But some researchers say that convergence between studies could just be coincidence. For a true understanding of how deadly the virus is, scientists need to know how readily it kills different groups of people. It's important. The risk of dying from COVID-19 can vary considerably depending on age, ethnicity, access to healthcare, socioeconomic status, and underlying health conditions. More high-quality surveys of different groups are needed, the researchers say. IFR is also specific to population and changes over time as doctors get better at treating the disease, which can further complicate efforts to pin down. The more you know about it, the better you're able to treat it. We're coming up with different ways to treat the symptoms, different things like that. Getting the number right is important because it helps governments and individuals determine the appropriate response. Calculate too low of an IFR and the community underreacts, and they are underprepared. Too high and the overreaction could be at best expensive and at worst could add harms from the overuse of interventions such as lockdowns. So we continue. Some of the first indications of the virus's deadliness were gleaned from the total number of confirmed cases in China. In late February, the WHO crudely estimated 38 people had died for every 1,000 with confirmed COVID-19 diagnoses. The death rate among these people, known as the case fatality rate, reached as high as 58 out of 1,000 in Wuhan, the city where the virus emerged. But the estimates were exaggerated, the disease's deadliness, because they did not account for the many people who had the virus but were not tested, obscuring the outbreak's true spread. Researchers tried to address this gap by estimating the IFR from models that projected the virus's spread. The result from these early analysis hovered around 0.9%, which is 9 deaths for every 1,000, with a broader range of 0.4 to 3.6%. His own modeling estimated an overall IFR for China of 7 deaths for every 1,000 people infected, increasing to 33 per 1,000 among those aged 60 or older. So again, from all that, it's important to know how it affects different age demographics and people with underlying conditions because, again, that's going to determine what kind of response you would want to take. So as a, average everyday citizen, you're going to want to know, I'm this age, I have this many health problems. Am I more at risk or less at risk for, getting COVID-19 and dying from it? If based on, all the risk factors I have in my age, if it doesn't look like I'm going to have more than just, some mild symptoms and it couldn't kill me, but if the odds are very, 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 very low that it's going to kill me and I'm not going to have too many issues with it, I'm probably going to be more willing to, get back out there, get back into working, whatever it may be, than if I'm very, very old and I have a lot of, health problems. I'm probably going to be more cautious and careful and see if I can, adjust my lifestyle accordingly. So we'll continue. How deadly is SARS-CoV-2? The infection fatality rate is the proportion of the people with COVID-19 who will die from the disease. Estimates for specific regions. It shows the different estimates based on countries, and that can vary due to a bunch of different things. Russell's team also used the data gathered from a large COVID-19 outbreak on the Diamond Princess cruise ship. Almost all of the 3,711 passengers and crew were tested, enabling researchers to count the total number of infections, including asymptomatic ones, and deaths in the known population. From this, his team estimated an IFR of 0.6%, or 6 deaths per every infected people. And that number also lines up with the general population numbers that the other studies were showing. The intention of these studies was to gain some ballpark estimates of how deadly COVID is. But researchers also had to make complicated estimates, which still needs to be verified, about the number of confirmed cases and actual number of infected people. There is value to obtaining rapid early estimates of the IFR, but these should be updated as a matter of urgency once better data becomes available. And that's the thing. As this stuff's updated and comes out, people need to know about it and need to know the real information and the accurate information. You can't continue to go on telling people that everyone's going to die from it if the numbers come out and show, hey, wait, it's not as deadly as before, or it's only deadly for, these group of people in general. You need to clarify these things for people so they know. It's important. Antibody surveys. Widespread population surveys that test people for antibodies to the virus, known as the seroprevalence surveys, were expected to help refine IFR estimates even further. About 120 seroprevalence surveys were underway worldwide, but results from the first antibody studies only muddied the water, suggesting that the virus was less deadly than previously thought, and it got a bit messy. One of the earliest studies tested 919 people in the German town of Ganglet, where a large outbreak occurred. Of these people, about 15.5% had antibodies against the virus, 5 times higher than the percentage of people known to have COVID-19 in the town at the time. The figure was used to estimate an IFR of around 0.28%. Now, that's very low compared to the other ones they were talking about. It's even lower. But researchers noted the study was based on a relatively small number of people. Other early seroprevalence studies did not properly account for the lack of sensitivity and specificity in the antibody test kits that were used, or the discrepancies between the sampled and underlying populations. These issues could have inflated estimates of the total number of infected people and so made the virus seem less deadly. Equally, if COVID-19 deaths go undetected, a problem in many countries that aren't testing all diseased people for the virus, that too can bias fatality rate. Some larger studies have emerged in recent weeks, and of those estimate a higher fatality rate than do early studies. One survey posted of more than 25,000 people across Brazil, an estimated IFR of 1%. Another survey tested people reports a prevalence of 5%, although the results have not been formally analyzed. The survey team did not calculate a fatality rate themselves, but on the basis of the results, verify estimates that Spain has an IFR of around 1%. And it continues. It goes on, IFRs of 0.6, but higher for people 65 and older, around 5.6%. So overall, again, they don't have exact numbers yet. This virus is still new. It's coming out. But as they study it more and more and more and more of these numbers come out, and we see the people who actually have it, the number is way greater than we thought due to increased testing. Around the general population estimates between 0.5 and 1%, like here 0.6%. But as you get older, the percentage is higher, right? So once we get these estimates of who is most at risk and who is not, we can make decisions and let people make decisions based on that information, right? Okay. Moving on to another article here. So this one talks about how many people will recall the fatality risk debate that took place prior to and in the early stages of the lockdowns. There was much discussion over how deadly the virus was and what the collective response to the virus should be. A very important discussion to have. We need to know how deadly the thing is. Some voices exercise caution. The public is behaving as if the epidemic is the next Spanish flu, which is frankly understandable given the initial reports have stacked COVID-19 mortality rate at about 2 to 3%, much higher than the results we're seeing right now, which is quite similar to the Spanish flu pandemic that killed tens of millions of people. Allow me to be the bearer of good news. These frightening numbers are unlikely to hold. Similarly, on March 5th, vaccine expert Paul Offit, who holds Marisar Hillman Chair of Vaccinology, believed that the World Health Organization's 3.4% fatality rate figure was too high, suggesting it was well below 1%. We are more the victim of fear than of the virus, Offit said, adding that the world was witnessing a wild overreaction to the disease. This was back in March. Voices like those of Faust and Offit were quickly drowned out, however. The 24-hour news cycle fanned collective fear and outrage that more was not being done. Runs on toilet paper and masks ensued. Neil Ferguson, professor of mathematical biology, predicted millions would die in the best-case scenario. Following the example of China, one of the most authoritarian regimes in the world, most of the developed world was placed in an indefinite lockdown by their own governments. The social and economic costs of the lockdown soon became apparent. The U.S. alone has seen 40 million jobs lost, many of which aren't coming back. Recession looms, hundreds of thousands of businesses have already been wiped away, and the federal debt has surged to $26 trillion. Unfortunately, the COVID-19 disaster and the Iraq war, they talked about that at the beginning, fit a familiar pattern. As historian Paul Johnson observed, most of the worst events of the 20th century were perpetuated by experts who used collective power to shape world events in a direction they believed beneficial. One of the principal lessons of our tragic century, which has seen so many millions of innocent lives lost. So nobody denies the imminent cost of the lockdowns, but what was gained by them remains a subject of contention. A May report from JP Morgan, as well as other evidence, suggests that the lockdowns had little to no impact on the spread of COVID-19. So, Marco Kolovak, a physicist and strategist for JP Morgan, pointed out the majority of nations saw declines in infection rates after the lockdowns were lifted. Unlike rigorous testing and new drugs, lockdowns were administered with little consideration that they might not only cause economic devastation, but potentially more deaths than COVID-19 itself. And it goes on there talking about it more. So, yeah, it's crazy. I mean, we're getting information that, we're narrowing in on how deadly this thing is and how bad it actually is. And, it may not be as bad as people initially thought, as we're seeing. Like you said, we're trusting these so-called experts that, claim they know exactly how things are going to work and how it's going to play out. Look how many times the narrative around COVID-19 has changed. Death number's too high. Death number's too low. No, they're right here. No, they're right here. Wear masks. Don't wear masks. Go out. Don't go out. Back and forth and back and forth. And it's all experts telling you this, right? It's all experts. We have our resident expert on. This Dr. So-and-so is going to come in and tell you all about COVID and exactly how to handle it, right? He's an expert. He knows. Well, seems like experts are all wrong quite often. And, things change. And they speak with such certainty, and it's like, I don't see a whole lot of people concerned with, getting accurate numbers as things go on. Once an expert comes out with something you agree with, that's your expert, and that's the expert you hang on to. And if anyone else disagrees, that's the expert you're sticking with. What was it back at the beginning? The WHO or the WHO with YouTube. It's like, if you don't agree with what the WHO is saying and their numbers and everything, your information is deemed fake news and misinformation. Even if you're a doctor and you come out and you talk about your personal experience with your patients and whatever, we're going to take you down because that's misinformation being spread, right? Well, turns out maybe WHO was wrong with their percentages. I don't know. Were they? It was pretty high compared to what the numbers they're finding now. So this is just crazy. A lot of this, it's politicized and turned into a weapon to be used on whether or not you want to shut down the economy, keep it open, and it affects so many different things. God forbid people just get accurate information on what's going on with the virus right now, what the current freaking death rates are and infection rates are, and people can make their own stinking decisions, right? Wouldn't that be the worst thing in the world if people were allowed to use their own brains to look at all the information and make a informed decision about it? Or do we just all need to be told what we're supposed to do and what we're supposed to, do with our lives next, right? We're not able to determine, hey, I might not be at risk. I think I'm pretty comfortable with going out. No, you can't do that. Infection rates are going up. It's just ridiculous, man. I'm tired of it. I'm tired of the way they put this information out there in select pieces, like I showed you with the graphs. It's it's still this thing of trying to portray the virus as something that we need to shut down our nation for again. Are you kidding me? I've gone through everything and shown you multiple reasons why the infection rates could have gone up. There are plenty of reasons. Yes, let's go over them real quick again. People are going out now that everything's not locked down. People want to go out and interact, do things. Again, testing is increasing, so that's going to show more people have it. So, like, I don't know. That we're seeing the death rate's not that high. Granted, any life lost is terrible, but like I said, we're human beings. We live in a world where there's full of disease and, you know, all kinds of different things that can kill you. But we adjust for those risks. We take those risks according to what the odds are that, you know, it's going to hurt us, and we weigh the benefits against them. And if we judge that there's more benefit to doing something, we go do it. Just give people the honest numbers to make these decisions and quit trying to shape what they need to do around, you know, your own twisted version of it. Can't just give them the numbers, really? Anyway, guess the whole point of this is that with all the information, try to share it with people, right? A lot of people don't have time to go through and look up all this stuff. And if they're not, you know, involved on social media a whole lot with people from both sides and can hear voices from everybody, if they just get their general news information from a few headlines, they probably don't know a whole lot about the numbers, and they don't know a whole lot about what's going on. So what I encourage you to do is, whether you share this video or you get the numbers from somewhere else, send them the links to the articles, just briefly mention that, hey, I don't know if you were concerned about going out or whatnot. Here's all the information, and then they can better make a decision to, you know, if they want to go out or they want to stay home. It's up to the people. But a lot of these news outlets and politicians don't want it to be up to the people unless it fits a certain, you know, agenda or narrative. Then, hey, we'll let you go out if it's this, but not if it's this. You know, you can go out and certain things are okay to do, like protesting and stuff. But if you want to open like a church, or if you want to open a bar or a restaurant, we advise against that because that's not necessary. Well, people out there, you know, different things are necessary to different people. If someone's like life depends on their business and that's where they make money to feed their family, yeah, I would say that actually is essential. So there you have it. That's pretty much it for today's segment. If you like the video, feel free to leave a like, subscribe. You'll be notified when new ones come out. Again, if anything, just share this or share the information from this with other people. Just help people stay informed. But that'll do it for today's segment. I thank you guys for tuning in, and we will see you in the next one. You guys have a good one.